Welcome to another episode of the Thriving Dentist Show. I'm Gary Tackes, your podcast co-host. Uh, those of you that are regular listeners to the Thriving Dentist Show know that we mix up the format from time to time. And today's episode is an interview format. We do interviews from time to time. And today's an interview format with my wonderful friend, Dr. Paul Henny. Hey, Paul, how are you?
I'm doing great, Gary. Always enjoy reconnecting with you.
Well, that feeling is mutual. If you're a regular listener to the Thriving Dentist Show, you will recognize the name and the voice of Dr. Paul Henny. He's been a returning guest a number of times on the show, and every time these episodes go viral because Paul shares such amazing information. And this particular episode is going to be a little bit more specific. Paul has recently published a book that I'm just going to come right off the top and tell you that it needs to be read by every dentist on the planet. And the book is titled CoDiscovery, Exploring the Legacy of Robert F. Barkley, DDS. So, Paul, first of all, I know this book has been a labor of love and has been percolating now for quite some time, but it must have felt really good to get it published.
Yeah, it's like getting something that's been on your mind for 10 or more years finally out, so you can start to focus your attention on other things, as well as just finally being able to step back and appreciate all the work that you put into it. But it's been a labor of love.
Yeah.
It's been something that I've been thinking about for a long time and working on physically probably for seven or so years. And I would pick it up and put it down, and I would learn a new little tidbit about this or that and rewrite something, and finally got it all together and struggled through the editing process and how to connect all these stories together in a way that it flowed and made sense and was useful. And I was finally able to do that.
Well, I'm on my third read. I'm almost through the book for the third time.
Yeah, there's a lot in there.
There's a lot in there, and I will tell you that now each time that I've read it, I picked up new information. And the new information it was there the first time, but it was more a reflection of where my mind was.
Yes.
And where my perspective was at that time. But this is one of those books that I plan to read at least annually because there's so much information in there. And Paul, before we go too deep into the book review, we'll have listeners to the Thriving Dentist Show that have recently discovered the podcast, and they may not be familiar with you. Our longtime listeners, of course, will be familiar with you, but those that are recently discovered, would you mind giving a little bit of background on yourself?
Sure. I'm a practicing restorative dentist in Roanoke, Virginia. My practice is fee for service. It's very what I would call person-centered, and the book is very much about that. It's about how to work with your patients on an individual level and kind of develop a effective goal-oriented relationship with them. We are, as I said, totally fee for service. So we are kind of in a niche in the marketplace, and we're thriving doing that. I've been able to do this because I've worked a lot on understanding the best way to develop this model. And that came through learning under a lot of other people and reading a lot of things. And that, to a large degree, is the contents of the book. But I'm an 1984 graduate of the University of Michigan, and I taught at the University of Kentucky Dental School for a little while, and I've been in associateships and eventually bought this practice here in Roanoke back in 1994, and it was full of insurance, and I developed it over time into what it is today, which is something that I enjoy coming to every day. It's my home as much as my house is now. And I work with a team of people that I enjoy being around. We work with patients we enjoy being around, and we have very successful outcomes working with people. And all of those processes and the sort of the thinking behind all of it is what's in the book. And there, as you said, some of the contents of the book took me years and years to understand as well. So one of my goals really was to try to present that information maybe in a way that's a little easier to digest. For example, when I first got exposed, there's a lot of Avram King in the book. When I first got exposed to Avram, he blew me away. He was such a smart, high IQ guy, and usually would think and write on a level that was several levels above where I was at that point in time. And it took me close to 20 years to really figure out what he was talking about. Like the chapter on boundaries, for instance, was heavily influenced by Avram King's work. But the first time that I read that, I really didn't totally get it. And I didn't really understand how that applied to me on a personal level. Or what I tried to display in the book was, how do you apply that in your practice? Because these are all these interpersonal issues are really what makes a practice work well, or it makes it dysfunctional. So if you have this level of understanding that's in the book, then you can kind of stand back and analyze why there are problems with certain systems that you have, or patients, or even team members. And so it gives you a framework, a lattice, to be able to understand the complexity of human interaction more effectively. So that's kind of how I got here. It was a long journey, a lot of stumbling, a lot of mistakes. And but my goal was to just try to make it easier for people to digest some of this information, so that they could create their own practice, create their own pathway. There isn't one way to practice dentistry. Really, it needs to come from your heart. And the more it comes from your heart, the more effective you're going to be with both yourself and with others.
Paul, of course, we call the podcast the Thriving Dentist Show, and I've often been asked by our listeners, Gary, what does it mean to have a thriving practice? And my answer to that is that it's a practice that provides personal, professional, and financial satisfaction. And personal satisfaction I describe as taking care of people you enjoy by team members you love. The professional satisfaction I describe as doing the kind of dentistry that you like to do, whatever that is. As you know, Paul, dentistry comes in lots of different flavors. And to me, professional satisfaction is doing the kind of dentistry that you really enjoy doing, whatever that is. And then finally, financial satisfaction is a little more self-explanatory, but it means you're being compensated handsomely and fairly for your care, skill, and judgment. And you are someone I think of as having a thriving practice. And it's not just a destination that you get to, but it's something that continually evolves.
Yeah, I mean, it's at the time of this recording, we're right after Christmas time, heading into the new year, and it's a time of tremendous reflection for me. What went well this year? What do I want to see happen this coming year? What things do we really need to work on, get better at? What new things do I need to learn more about? How can I help other dentists in this way? How can I help them see some of the things, or experience some of the things that I experienced that were really key turning points for me? One of the bigger concerns I have, Gary, is that with the diminishment of individual fee-for-service practices out there, younger dentists aren't getting the opportunity to go into these places and see them and feel them and understand how they operate and how unique they are. Yeah. And I had the opportunity to do that very early on. Just a couple years out of dental school, I was exposed to a practice of a dentist who had trained at the Pankey Institute, and he had every case on a semi-adjustable articulator. And I had the opportunity to expose to an orthodontist who was doing mid-facial development and condylar growth, and had every case on a SAM2 articulator. So my eyes were opened early, not to say that I was ready to practice dentistry on that level at that point in time, but it helped me visualize where I wanted to go. So, one of the concerns that I have today is there are just fewer and fewer opportunities for younger dentists to get those experiences and build that vision that may take 20 years to develop, but it's important to kind of create that early, and then you can create an organized plan that takes you in that direction, which, you know, to a large degree is one of the reasons we do the workshops together, Gary, is
Right.
I try to get people together with people that are doing it and people that are on their own journey, and for people to just see and experience the vast different ways that people can practice successfully, and meet some of these people, and just in an environment where, you know, the egos aren't dominant and everybody's open and honest and sharing, and that's what's really fun about this stuff.
And for the record, Paul is the developer of a CoDiscovery workshop that I've been privileged to participate in a number of times now. And that CoDiscovery workshop is just a wonderful experience to kind of see what this is all about and think about how you might apply that to your practice. Well, Paul, thank you for that background on yourself, especially for our new listeners. Likewise, some of our listeners will not be familiar with Dr. Bob Barkley. Would you now this is a difficult assignment to summarize concisely Bob Barkley, but for listeners that may have never heard of him, who is Bob Barkley, and why is he more important than ever today? So I loaded that one with two questions for you.
Yeah. Well, Bob Barkley is probably one of the most influential people in all of dentistry that most people don't know about today. But if we were to take you in a time capsule and put you back 40 years, everybody would have known who Bob Barkley was, because he was the most popular speaker in all of dentistry. He would speak three to four times a week, and he did that for about 8 or 9 years in a row. Traveled all around. He had his own private plane, and he would fly into little study clubs all around the country, and on big jets would go into bigger meetings. But he was speaking all the time. I think his record meeting was he spoke to 3,000 people in one auditorium in San Francisco in the 1970s. So
That
he
would have been the
was,
big ballroom.
yeah, he was a literal rock star of his age. And, you know, how could that be? I mean, he was a country boy, essentially, from South Central Illinois. And he had trained under Dr. Pankey and other people. And he essentially took that knowledge back to his hometown, or near his hometown in Macomb, Illinois, and tried to apply it, and really struggled doing it. And the result of that struggle was finding out better ways to apply, particularly on the human side of things, to get patients to accept more comprehensive care. So go
I
ahead.
remember so vividly the story that Bob Barkley told about how he had the clinical knowledge and he knew how to treat the case, but he didn't have the behavioral skills to present that information in such a way that would encourage the patient to accept his recommendations.
Right. So the big distinction really between Dr. Pankey's experience in Coral Gables, Florida, and Bob's experience in Macomb, Illinois, really was a demographic challenge. Dr. Pankey, to a large degree, built up his practice and his reputation based on some fairly well-to-do patients who summered down there or lived in Coral Gables. Well, Bob didn't have that luxury. Most of the people in his community were middle class or lower. They were farmers, or maybe they taught at the university, and back then university faculty was not paid well. And so the challenge to Bob was, how can I not compromise my principles? How can I apply what I've learned in this group of people who really can't afford it nearly as easily? And the solution that Bob came up with was, well, if I can figure out how to get people to prevent their disease progression, I can stabilize them for a while until they could afford to do the right thing. So that really is what made Bob famous.
So prevention was really at the core.
That was the linchpin. Yeah.
That was his his approach to helping patients in his community get in better oral health.
Right. So, and the immediate problem he was confronted with was uh, just telling people what to do didn't work. So, just telling people to brush more and floss more didn't work. So he was, and this was a problem that he had very early on in the early 60s when he came in contact with a guy named Nate Cohen, who had a PhD in educational psychologist and was a brilliant man. And he actually taught Bob more about how people actually learn. He
I
taught,
think of I think of Nate as being, one of the pioneers in adult education,
yes,
how
and
adults learn.
right. And so he essentially taught Bob about experiential learning and how to involve patient in the learning process, how to make them curious, how to get them to ask questions, how to engage them in the discovery of their current state, as well as visualize what they want for themselves long term. These are conversations that patients never had with dentists before Bob came along.
Well, let's
So
remember too, Paul, that we're going back 50, 60 years, and let's remember that at that time it was not unusual for someone to go to the dentist and have all their teeth out and have a set of dentures made, and there were segments of the population that thought that that was normal, that was what was to be expected, and that was going to be their outcome.
there's no question about it. Partial edentulation or full edentulation was the norm. I think I heard from Gordon Christensen that the average number of teeth in the mouth of a 60-year-old in 1965 was about 6. So when everybody around you, that's their situation, they're wearing dentures and maybe struggling with them or have a partial that they hate, that's the group of people Bob was working with. But he was trying to catch them much earlier in that destructive cycle and get the disease progression to stop so that they could essentially buy themselves enough time that they could save up the money to restore their mouth properly and then successfully maintain it over time. So that's what Bob became very famous for teaching, both the process of helping people prevent and stabilize disease states, as well as how to communicate with people more effectively so that they would follow through with that, as well as engage in a visualization process so that they could choose a more desirable future. So he flew around the country and was very rapidly changing dentistry. And then he tragically died in an airplane crash in 1977 after writing a very famous book that was published in several languages and is still well known today. If you can find a copy, it's very, very cherished. So he was very, very famous, and then he just disappeared. So as the generation of dentists who experienced Bob Barkley so intensely and so meaningfully have retired or passed away, that knowledge has kind of drifted away as well. So a big part of the book is to kind of bring all that information back together in one place so that the readers can learn more about all of this incredible thinking and processes that Bob developed at that time. And as you do that, you'll realize, well, hey, that's kind of what we're doing today. You kind of realize where some of these things actually originated from.
Right. And I want to brag on it for just a minute, Paul. The book is called CoDiscovery, and you've done a brilliant job of bringing that information into the current times, into practice today. At the time this is published, this will be published in early 2024. So you've done a brilliant job in bringing this information into 2024 and beyond. Now, there will be listeners that are hearing the term for the first time, CoDiscovery. How would you succinctly describe what CoDiscovery is all about?
Well, I mean, the simplest way to think about CoDiscovery is it means learning with. So it's really all about experiential learning. How can you set up, and this is particularly important with new patients, but it's very relevant with patients that are coming back through your ReCare program as well. How do you set up situations? If you think about the time that you spend with a patient as multiple learning moments, potential learning moments. If there's a critical point that you really want the patient to know more about so that they can make a better decision relative to it. Let's say they've got a problem with bruxism that's destroying their anterior guidance of their teeth or something like that. But they're so used to seeing themselves in the mirror that they think their shortened teeth are actually normal. And they see their friends that kind of look like that too. And to them, that's normalized. How can you engage them in a conversation that helps them realize that, hey, that's really not normal? That's actually occlusal disease, slowly progressive. It's not necessarily painful, but it's going to lead to an outcome they probably don't desire. But have they ever had a conversation around that? Have they ever had the opportunity to see what that outcome might look like? Have they ever had the opportunity to understand what their teeth probably used to look like when they were 18? So how do you set up a relationship or touch points where what they're learning is immediately relevant to them and engages them on a level that it prompts them to ask you questions? And it's a back and forth of listening, exploring, and allowing that to kind of percolate, because people will reprioritize their time and money and so forth, but only they'll do it when it's relevant and timely. And so it's a matter of Bob was very strategic about the way he interacted with people, and I talked a lot about that in the book. And if you think about every opportunity you have with your patient is potential learning moments, then that's really what CoDiscovery, that's the core of CoDiscovery.
Yeah, and that co-discovery process is so very different than the way virtually every dentist learned how to present dentistry.
Yes.
In my perspective, and of course, I'm not a clinician, as you know, Paul, but the way virtually every clinician has been taught back to dental school is identify a problem, present a solution. Identify a problem, present a solution. And that method is just intrinsically flawed, because you may be presenting a solution before the patient has any idea that they actually have a problem.
Right. I mean, you have to understand that everybody else is just like you. They've got 100 other things that are going through their mind. Some things are more important to them than others. Before we started this recording, you talked about Teresa's mother visiting with you over a couple of weeks. I'm sure that shifted all kinds of parts of your daily and weekly routines around, because all of a sudden that was your priority. Right. I mean, everybody coming in the office has things like that and much more extreme going on in their life. And so you've got to be patient with them. You've got to get a sense of where they are and what they're capable of doing right now, what their priorities are. But at the same time, you've got a responsibility to try to lift them up and help them make better decisions relative to their dental and overall health. That's the role that you have. If you have a truly preventive oriented practice, a true health center practice, then that's the role you need to assume. So you've got to do that in very thoughtful, strategic ways. And Barkley was brilliant at that. One response that you would almost expect to hear from somebody, well, why should I read a book about somebody that's been dead since 1977? What kind of knowledge would, these people that are in the, 1960s and 70s, what kind of information do they have or did they know that's even relevant to what's going on right now? I've got this fully digital practice and we've got all these amazing things we can do with video and this and that and the other thing. Why should I spend my time studying stuff that was happening 50 years ago? And my answer to that is people never change. The things that we're struggling with today is the same stuff that Aristotle wrote about. It's just the same. People are people. They're largely emotionally driven. They've got certain glitches in the way their mind works. And I go into that in the book as well, to understand how the mind work is really an important part of being a more effective educator. And that's our other role. Doctor means teacher, and you've got to learn how to be a more effective teacher, and that's through leadership.